I'll bet facial fat is something you haven't spent a lot of time thinking about. But think about this. You know, when you were a baby or you have children or grandchildren, you can notice they have a lot of fat in their face, right? Not that they're overweight or obese, but they just naturally have more fat in their face. Well, we lose a lot of that fat as we age. Now, this has come to a head lately because of the GLP-1 agonist disaster, because people are being prescribed these drugs to lose weight, and they do, but much of the weight lost is subcutaneous fat. So the fat we want to lose mostly is abdominal visceral fat. That's fat within the abdomen that is encircling the liver and pancreas and interwoven into the intestines. That's the fat we want to lose because that's inflammatory fat. That's the fat that distorts your hormones, raises insulin, leads to diabetes, and causes even more weight gain. So abdominal fat is very destructive fat. Subcutaneous fat, fat just below the skin, is not such a problem. It may be an aesthetic issue. Maybe you have some fat in your buttocks, for instance, or in your thighs you don't like, or in your neck. But I'm not talking about that kind of fat. I'm talking about natural fat just beneath the skin. Well, these GLP-1 agonists preferentially cause you to lose subcutaneous fat and not abdominal visceral fat. You do lose some abdominal fat, but it's preferentially targeting subcutaneous fat. And you lose a lot of muscle on these drugs. So if you lose 40 pounds by taking Ozempic or Mounjaro, say, of those 40 pounds, 10 pounds will be muscle. That's a lot of muscle. And a lot of that muscle distributed throughout the body, but includes the face. So on these drugs, people lose subcutaneous fat, including in the face, and lose muscle, including in the face. So if anybody you know has done one of these drugs and lost weight, you'll notice they look much older. Their wrinkles are much deeper, their jowls sag, so they're thinner. And by the way, they're not very healthy once this happens. But you notice they look 10 to 20 years older, what some have labeled Ozempic face. So preservation of facial fat is an important thing. And this really came to, I started thinking about a lot of this because there's a multi-millionaire guy named Bryan Johnson. Apparently he made a lot of money selling a company, and he's been obsessed with looking younger and perhaps with longevity as well. Well, apparently he lost the weight by reducing calories, but he noticed that when he achieved his target weight, that he'd lost a lot of the contours of his face. He looked older, and he thought it was due to loss of facial fat. Now, you and I know it's also from loss of facial muscle, but he thought it was from loss of facial fat, and this troubled him, and he wanted to regain it. So he made a lot of efforts to try to regain facial fat or facial contours. So when you lose weight, by any method involving a reduction in calories, we could call it a bariatric procedure, like lap band or gastric bypass. We could call it a GLP-1 agonist, like Mounjaro or Ozempic. Or we could just have a program, like Weight Watchers, Jenny Craig, or an app that tells you to stop eating because of emotional triggers. Regardless of how you reduce your calories, reducing calories will cause you to lose muscle. About 25% of your weight loss will be muscle. And when you lose muscle, your metabolic rate, your basal metabolic rate, your so-called BMR, drops. And for all practical purposes, it drops permanently. So that even years later, your metabolic rate is reduced. It means that if you lose weight by reducing calories, regardless of method, you're going to regain the weight, even if you maintain a low-calorie diet and an exercise program that includes resistance exercise. So you set a trap for yourself when you do these things, and you will experience a loss of facial fat and facial muscle, and you'll look older. So how can we conduct our lives so this doesn't happen? We don't lose subcutaneous fat in the face, or if there's excess fat because you're overweight, that's different. But I'm talking about in a normal weight person. How do you maintain subcutaneous fat and facial muscle? In the face, of course, and elsewhere. Well, one, never reduce calories. So you can reduce calories for a day or a couple days, maybe 3 days, but if you keep on doing it, you're going to lose muscle. And you're going to reduce your metabolic rate, you're setting a booby trap for yourself, and you're going to lose facial muscle and facial subcutaneous fat. So never reduce calories for more than the briefest period of time. Be sure you're getting collagen. Now, modern people don't like the idea of eating organ meats rich in collagen or tough cuts of meat, so most people will resort to collagen supplements like bovine collagen, 20 grams per day works, and that has many effects, but it includes a restoration of youthful muscle, and it does facilitate to a modest degree loss of fat, abdominal fat, not subcutaneous fat. You want to take steps to bloom species of microbes in your gastrointestinal tract. We've talked about this before, that produce butyric acid or butyrate. Because when you have a lot of butyrate, many good things happen, but it also supports muscle and facilitates loss of fat, abdominal fat, not subcutaneous fat. And then lastly, consider getting Lactobacillus reuteri, our favorite microbe, and even better, make it into a yogurt. So if you take MyReuteri, that's my brand of reuteri, MyReuteri, at oxyceutics.com, OXICEUTICS. That's where you get the microbe that I like to use, and we make yogurt out of it. We get 300 billion microbes per half cup serving, and that also adds to these effects. So, because we want youthful facial fat, we want youthful facial muscle, and we don't want to risk losing it. And we don't want to spend a lot of money like that guy I mentioned who does all kinds of crazy things, like he wants to inject fillers. Some people inject fat from their buttocks, for instance. No, let's not do any of that kind of nonsense. Let's take natural methods to preserve or increase facial fat and facial muscle.